Just open our eyes around us, and we see scores of utterly helpless human lives fighting the distress of diseases, destitution, disability, and mental illness. No other pain is greater than this extremely agonizing helplessness. As we help them out, we understand that nothing can make our lives more prosperous than the prayers or the thanksgiving gestures from them in return. It was this realization that spurred the humanitarian interest of a few people to cast the shades of love, care, and compassion to them. Thanal, thus formed in 2008 with a sole philanthropic mission, has now spread over 11 states in India. It has 85 branches in the country, offering various services with 5,000 daily beneficiaries who are living with this caring journey. There is a guiding principle that's ingrained with the team of Thanal. It underscores to serve the needy is not just an act of magnanimity or expression of empathy, but is undoubtedly the duty or moral obligation of you and me. On the other end, to receive such services is the noble right of the beneficiaries. Hundreds of poor souls abandoned on the streets or on the corridors and verandas of government hospitals have been welcomed to the homes of Thanal over these years. The members of Thanal homes are let free to enjoy the tranquility of a peaceful living space. Apart from food, clothing, and medicines, rehabilitation aids and therapeutic support are offered to them to bring them back to a normal life. Today, 750 members are cared in the comforts of 10 Thanal homes in Kerala and Karnataka. More than 10,000 inmates from Kerala and other states have been sheltered at these homes since the inception of Thanal. One such home is exclusively set apart for accommodating HIV-positive destitute patients. The psychological hardships suffered by them due to financial deprivation, social discrimination, and exclusion from the dear and near ones thrust them into an intolerable living condition. Instead of probing much into their previous life, making a difference in these people with a tender touch of care is the prime object of Thanal HIV Center. Appropriate medical assessment, treatment, medication, and rehabilitation initiatives are ensured in order to take them back to social mainstream. There are a large number of homeless, destitute street dwellers in India. Thanal is spreading its wings nationwide to save and safeguard these hapless human creatures. The care for this disease-stricken, poverty-hit humanity has no limits and is beyond boundaries. The community dialysis model introduced by Thanal has been very well received in Kerala and is benefiting hundreds of poor patients with free-of-cost dialysis. Thanal is the largest charitable community dialysis network in the world with 48 standalone dialysis centers now operational in Kerala, Karnataka, Tamil Nadu, and Pondicherry. Establishing one such center for 4 panchayats is the immediate aim on which its dedicated team is working steadily. Thanal's mass community awareness on renal health aimed at the early prevention, detection, and treatment of kidney diseases has made a remarkable impact in the state. A revolutionary movement in kidney transplantation has been launched at Ikra International Hospital and Research Center in Kozhikode with the support of Thanal. The net transplant expense under this special scheme is only 275,000 Indian rupees. This is the least kidney transplant expense in India. The transplant service is offered even cost-free to the deserving poor patients. The schools for differently abled and the early intervention initiatives of Thanal are going hand in hand with positive outcomes. There are around 800,000 children with various types of disabilities in Kerala. While trying to identify God's purpose in creating differently abled children and glorifying them as God's gift or God's own children, our society does not devotedly endeavor for enabling them to grow up normally. We shouldn't disregard their rights and needs to mingle with other children and interact with their natural and social environment. They too have a space among us. Thanal's early intervention program is driven with a key idea of providing specialized support for the children born with disabilities so that they become socially self-standing individuals. They would thus get a better place and would stand on their own feet. Making earliest interventions for the proper assessment and care planning in a child's life is hence very much important in this context. Trained healthcare professionals are appointed by Thanal in the neonatal ICUs of major hospitals for the screening and assessment of newborns. Interventions are applied to treat infants found with disability issues so that they become normal children at the age of 3. Improving the outcomes from these children by providing them physiotherapy, speech therapy, occupational therapy, and psychological assessment is aimed at. The children who are seen with abnormalities even at 5 are admitted to the schools for differently abled run by Thanal. Special education provided in these schools comprises therapies, life skill lessons, and specialized training that would help them to lead an independent life. Those children marked with significant improvement in the periodical assessments are sent to normal schools. Vocational education is provided to the students aged 15 and above at Thanal schools. They are trained with the required skills to secure employment opportunities for a self-standing living in their society. The total strength of 12 schools run by Thanal exceeds 1,000. Thanal looks forward to establishing an early intervention center in each town and city in the state. A special Thanal center functioning in Kannur accommodates orphaned, abandoned children with disabilities. They are cared with love, parental affection, and everything that make their childhood happy. The volunteers of Thanal there transform themselves to the roles of the parents, siblings, and the dear ones of these children. Thanal at present runs 2 centers for the victims of spinal cord injuries, each in Kozhikode and in Kannur. Hundreds of paraplegic patients confined to a bedridden life within the 4 walls of their room for long have been brought back to normal life through this therapeutic rehabilitative intervention. Thanal will be soon seen instituting an acute neuro-rehabilitation center equipped with advanced facilities for reviving such bedridden lives. Thanal's concept of community psychiatry evolves with a compassionate outlook. The treatment by the doctor reaches to the patients within their physical interactive settings rather than the patients reaching to the doctor. The society is reminded of their fundamental role in bringing these patients back to normalcy. In the backdrop of COVID-19 pandemic, Thanal joined hands with ICRA International Hospital and Research Center and opened 2 COVID-19 treatment centers in Kozhikode. Every day, more than 400 poor COVID-positive patients are offered free treatment here, including pregnant women and dialysis patients. Thanal comprehended the need to address the crisis posed by water scarcity in several parts of the country and launched a well water project to overcome it. More than 500 wells have been drilled yet. In the second phase of this project, Thanal plans to make 1,000 more wells. Thanal, under its free housing project, has handed over more than 1,000 homes to the extremely poor homeless people in Kerala and Karnataka. A significant number of them were devoid of their shelters in natural calamities like floods. In the second phase of this project, Thanal aspires to hand over 2,000 more homes to the needy ones in North India in 2 years. Thanal is not a one-man mission. It is but a team of like-minded, kind-hearted human beings with a unified, humane vision regardless of caste, religion, color, region, or any such distinguishing parameters to care for the suffering humanity. The team of Thanal owes all their humble, noble achievements to the humane helping hands and kind-hearted association of a number of benefactors, philanthropists, well-wishers, and the public who have always stayed as our staunch pillars of support. Many more philanthropic initiatives of Thanal are in the pipeline. With your esteemed collaboration in the best possible ways, we shall materialize these dreams in no time. We want you to join our dreams to help the poor and the needy and make the world a better place to live in. They need us to touch them with love, care, mercy, compassion, consolation, strength, and support. We believe it is our righteous liberty to welcome you to be part of Thanal. We solicit your best support in whatever way it is, either by donating your money, resources, time, and effort, or by sharing your thoughts and visions. We shall not forget that our greatness is not what we have, but what we give. We rise by making a difference in others' life and lifting them. The smallest acts of our kindness are better than the greatest intentions we have. Let's not forget that someone is sitting in the shade today because someone planted a tree long time ago. Join our dreams and we will take this noble vision forward.